Press conference on the coronavirus pandemic across the state. Let's listen in.
Today we are not joined by Dr. Box. She is still tending to a non-COVID family emergency. But filling in for Dr. Box, you've heard from and seen Dr. Lindsay Weaver before. Dr. Weaver is going to give us an update not just on the numbers, updated numbers on the ground, but also an update on a lot of progress that we've made recently in terms of testing and the expansion thereof statewide.
Okay. Good afternoon. I'm going to start by sharing some updates on the numbers. So today we reported 650 new cases and 57 new deaths from COVID-19. To date, 16,588 Hoosiers have tested positive, and a total of 901 have been confirmed to have died from COVID-19. You can see that we are holding steady with our ICU bed and ventilator availability, with 44% of ICU beds available statewide, and just 20% of our ventilators are currently in use. Before explaining more about our expanded testing program, I wanted to again remind Hoosiers of the scientific study that we are conducting with IUPUI Fairbanks School of Public Health. More than 3,700 people have registered to participate in phase 1, and we are well on our way towards our goal of 5,000. We want to assure Hoosiers who are being contacted to participate that this is a legitimate study and your help is truly needed. So we wanted to share with you a look at the postcard or text message you may have received. Additionally, you may have received a phone call or email. We understand that this is not a communication that you are used to getting, so it might cause you to question the legitimacy of the text message, but please respond. When you click on the link, it'll take you to the registration page. So this is a look at what those communications look like. And as you saw, the text message is from the Indiana State Department of Health and will include your first name and a unique access code, and that you will use that to help register. So now I want to talk to you about expanding testing that we are now launching. Indiana has been working diligently to enhance COVID testing capacity from the beginning of our response by using our strike teams and our drive-through clinics. And more than 87,000 Hoosiers have been tested to date. Today, we are excited to announce another step that will significantly expand testing and allow us to move closer to our goal of testing every Hoosier who has symptoms of COVID-19. Over the next week, Optum Serve, powered by Logistics, will launch 20 testing sites at select locations around the state, and a plan to increase to 50 sites by mid-May. This will give us an opportunity to do nearly 100,000 tests a month initially and test 30,000 Hoosiers a week when all sites are open. The state reached an agreement with Optum as a way to expand testing to all symptomatic Hoosiers while allowing the Indiana State Department of Health to focus on targeted testing of high-risk populations. So to go through a little bit more detail, as I mentioned, Optum Serve Health Services, which is powered by Logistics Health, is going to start opening sites next week. And again, a capacity to test 100,000 Hoosiers. So testing is for any symptomatic Hoosier as well as close contacts of positive cases or residents of congregate living settings. We're going to be extending testing, and that will be evaluated on a monthly basis. Optum Serve will collect the swab specimens and manage the testing and reporting of data. And people tested should receive the results within about 48 hours on average. ISCH strike teams will continue to test in long-term care facilities and other identified hotspots. Optum will be providing their own supplies, PPE, testing kits, staffing, and lab, which will increase Indiana's overall testing capacity. So we're expanding testing again to all symptomatic Hoosiers so that anybody can have the opportunity to get tested when they do have symptoms. And this will provide a more complete picture about the spread of the virus, not only in high-risk populations, but across the entire state. So Hoosiers can get tested without having to visit a healthcare provider. The State Health Commissioner, Dr. Box, has issued a standing order for the test so that any Hoosier who meets criteria can go and be tested. Again, ISCH will continue to focus on those targeted areas, including high-risk populations with its testing. 20 sites will be opening in Indiana National Guard armories in the next 7 days, with 50 sites total to be open in the following week. Each site will be open for at least 8 hours per day, Monday through Friday. And once all 50 sites are open, as many as 6,600 Hoosiers can be tested per day. This map gives you an idea of where these first 20 sites will be available. We're taking into consideration going to areas that probably did not have or have not had access to testing previously. And so we selected those locations, and we'll continue to select locations on where the testing is most needed. So who can be tested? Again, anybody that has symptoms, so cough or cold symptoms, fever, shortness of breath, headache, sore throat. If you develop symptoms, then you would just go into a web portal to get scheduled and then go to one of these available sites. Additionally, we will be testing close contacts of infected persons. So if you are somebody who maybe your family member or someone that you have been in close contact with in the community has tested positive, you too can go get tested for COVID-19. And additionally, want to test the symptomatic Hoosiers who live in any kind of congregate setting. As I mentioned, you'll be able to go to the Optum portal and self-report your symptoms using their online screening tool. Register to get an appointment date and time, and the registration portal will be open about 2 days before the testing sites actually open up. And this is going to be an NP swab or a nasopharyngeal swab, and more information will come out in the coming days. No one will be charged for testing. Having insurance is not a requirement, but if you do have private health insurance, we do ask that you bring that information. Web registration is preferred, but there will be a call-in line when available. The results will be provided to the individual tested and also provided to ISCH by Optum. The patients will receive a text or email if the test is negative, and if the test is positive, you will receive a phone call. So once all the sites are open, up to 30,000 Hoosiers will be tested weekly, in addition to the ongoing ISCH testing. Optum testing will expand options for Hoosiers without impacting what we are already doing across the state. It'll be in addition to it. So again, the focus is on all symptomatic individuals, not just the vulnerable populations or the healthcare workforce, and will expand testing options across more areas of the state. Indiana is the second state that Optum has started testing in, as they started testing in California earlier this week. So this slide gives us an idea of how we've already expanded testing in Indiana. So these are compared to our neighboring states and how many people are tested per 100,000. This is the increase, and it'll be really exciting to see how much we increase testing over the next week and month.
Thank you, Dr. Weaver. Just right before we get to the Q&A, sticking with the testing theme, there are so many people to thank for getting us to this point. I know it maybe seems like it's been a long time, more than 2 months, but we've come a long way fast, and it's only been possible because of the help of some critical partners. So proud to come right out of the gate with Eli Lilly and IU Health, who were just instrumental in kind of setting sail on this voyage, and then with Fairbanks to roll out that study that you just reminded us of, that being an antibiotic and a diagnostic study statewide. Again, 3,700 you said have signed up of that 5,000 goal. If you see the Indiana State Department of Health on that, or an in.gov website, that's legit. We need you to answer that call, so to speak, because we want to get to that 5,000. We want to get this information, and we're going to be doing more. Obviously, talked about this phase, but then we'll have another phase next month, and 6 months, and a year from now. So this is an ongoing. The breadth and depth of this study is going to be immense in not just the progress that we're making now, but what it will yield, the information that it will yield. Also want to thank so many other people who you hear from them off and on who have made all this testing possible, be it at the city level, on the ground where they're doing a lot of this on their own. The National Guard, you heard from Brigadier General Lyles yesterday, day before, who provide equipment and who provide security and so much more than that. Private companies like the Walmarts or Ivy Tech sites across the state, Maryville High School have all provided sites for us to do drive-through testing. That all adds into this equation. NDOT, who has been so instrumental in transporting equipment to testing sites, and last but not least, especially all of the local health departments who are providing everything they do every day, but also in this time, food and ground support as those sites have been stood up very, very quickly. I would just say that as much as we have done over the last couple months, we've got a lot more to do and a lot more work ahead of us. And I know a lot of folks are understandably, we are too, focused on this Friday and what May 1st will mean to our daily lives and our once routines, our habits. We are too. That's why we're working around the clock to get to Friday with those updates. But I just want to underscore everything that you've been doing to flatten the curve, to slow the spread. That's why we find ourselves in a position to make some new decisions about how we go forward. It's all been in an effort to slow the spread and flatten the curve and not overwhelm our healthcare system. And that's just been essential. Your actions, or non-actions for that matter, have been instrumental in putting us in this position. And so we're going to get the work done between now and Friday at 2:30 to be able to have some updates. But this testing, and you'll hear more about tracing tomorrow, just key parts, as I mentioned yesterday, key parts of the whole equation that we have to get dialed in correctly. And I'm proud of what Dr. Weaver just articulated, what she just shared about the ongoing expansion efforts in the state of Indiana. But make no mistake about it, we can do all that, we can make all the investments that we need to make, but we can't relax. Your physical distancing has made quite a difference. And the proof is in the numbers. And I don't want to ever kind of take a step back because we relax our behavior and just start thinking everything's back to normal. And so our Friday plan will reflect that new normal. And we'll not just contemplate, but we'll build into that all the new ways that we just must safely live, work, and play so that we can continue to experience this progress. I was reminded vividly Sunday by a story of Mary Massey of Crown Point, and Mary celebrated her birthday on the front porch with her sister sitting close by her. She was wearing a purple tiara, and dozens of cars passed her house to celebrate her birthday, including police and firefighters and EMS, sirens blaring, lights flashing. She seemed surprised on the front porch as each car passed by. At the end of the parade up in Crown Point, the mayor himself led everyone into a happy birthday song for Mary, and sitting next to her daughter, her daughter happens to be 88 years old. So, you know the rest of the story. Mary turned 107 years old, and she was just smiling away. Her great-granddaughter, and you can probably do the math and figure out that her great-granddaughter said that Mary has, throughout the years, kept her jokes, her wit, and her sass about her, and I believe it. Mary described herself as a party girl, and that she would see everyone next year. And so we're looking forward to seeing Mary at 108 next year, and we got to we got to do everything we need to do to make that a reality, knowing that we're all in this together, and truly united we stand and divided we fall. And with that, we'll go right to the Q&A portion. I'm sure we have a lot of questions over what Lindsay just shared.
Steve with KPC Media.
Good afternoon, Steve.
Steve, you have to unmute your own microphone.
Sorry, technical difficulties there for a second. How are you today?
We're doing great, and I can relate.
Yeah. My question is actually, I appreciate all the new updates on the testing, but Governor Holcomb, over the last 6 days, we've seen kind of what I've been calling around the office a mini surge in cases. The average number of cases has jumped up above 600 per day, where we had been more in the kind of 450 range before that. I know that's not the greatest timing with looking forward to Friday. So I guess with some of the numbers that you've been seeing, do you have any concerns about the latest activity with COVID in the state?
Well, I'm concerned with every number that comes in, and we look at every number that comes in, and as we continue to test, and as this COVID-19 continues to spread, my North Star is focused on is or is not the healthcare system that we have overwhelmed. And to date, it has not been. This is precisely the reasons why we ask people to change their behavior, to change their actions. We have been fortunate that so many Hoosiers, I mentioned a few just on the testing front, but so many Hoosiers privately and their businesses have retrofitted what they were doing in life before, and they started making PPE themselves and supplying hospitals and supplying grocery stores and supplying frontline personnel with PPE. That's helped us endure this as well. As much as we've purchased through the IEDC, the Indiana Economic Development Corporation, our procurement efforts, people stepping forward has helped us as well. So it's not just focusing on the positive cases that will continue. This could be with us, folks, for a year. It's how we manage our way through this and how we keep that curve flat enough so that our healthcare system can care for those folks who are in need. And so absolutely, we look at cases, positive cases. We look at that ratio. We look at the death rate for sure. But we also are laser focused on our hospitalization rates. We're focused on the vent availability, the ICU bed availability, whether it's in an area like Cass County or that district, the Health District 4, I think it is, or any other of the 10 districts in the state of Indiana. So it's not just one area that we look at, especially since we're increasing our testing and will over this next month. So we'll identify more positives for sure. But how are we, and that's why, again, Steve, so important to have this testing that you heard about today, expansion, and the tracing, the testing and tracing to help us isolate those positive cases that you highlighted, to help isolate those, get them out of the mix, and see our way through this.
Abdul Hakim Shabazz, Indy Politics.
Good afternoon, Abdul.
Good afternoon, Governor. A couple things, mostly for you. Number one, CNBC is reporting today that Simon Property Malls, so they're going to be opening their malls in Indiana on Saturday, May 2nd. Do the malls know something maybe in advance of your Friday directive that you'd like to share with us a little bit early? Because I'm assuming they wouldn't be doing something like this unless they spoke to some folks at the state level. That's number one. And number two, any concerns about your executive orders, seeing what just happened next door in Illinois yesterday, where a Southern Illinois judge issued a temporary restraining order against your colleague Governor Pritzker's executive orders. Granted, it was only for one individual, and the judge saying that the governor didn't have the authority to extend executive orders past that 30-day window.
I'll take your first question first and your second question second. I have spoken to the Simon Mall Corporation, the CEO, David Simon, but he does not know what is in our, I say that respectfully, he does not know. He weighed in like we asked every other sector in our state. We're very proud of Simon Malls being headquartered here in the state of Indiana, and all the contributions that they've made throughout the years to our state. But to answer you very directly, Abdul, no, they do not. And we will share that, and malls will be included in our guidance. So I'm trusting everyone will be aligned at the end of the day on that front. In terms of your second question, we're just convinced, and I can have my general counsel come up as well, we're convinced and confident that any action that I've taken has been constitutional, and it's been out of the necessity to ensure public health. And as for what happened in Illinois, I don't know what all the motivations were for the individual to bring suit, but in terms of Indiana, we're squarely within the legal authority to do so.
Joe Herons, General Counsel to the Governor, and I can't speak to Illinois law. The emergency management laws of the states are somewhat similar, depending on the state. Sometimes they're different, but it's an important question that you've asked. What I can say is that it goes to our civil liberties, to our rights and freedoms, which are foundational for our country and to our way of life. What I can tell you and what I can share with you is that care has been taken from day one, from that very first executive order issued on March 6th by the governor and by our office, to craft the executive orders in a way that keeps them within the bounds of the law. You hear the governor and Dr. Box and others talk almost every day about the facts and the data. And facts and data are so important to crafting the executive orders so they stay within the bounds of the law. And I think what's important here is that as the facts and data change, that you make timely adjustments to the executive orders to keep them within the bounds of the law, and those are things we've started to do. So for example, on Monday, we allowed elective procedures to resume. That was based on an evaluation of the situation. But those kind of adjustments are important to make, and I think as long as we do that, we stay within the bounds of the law going forward. I would also say the emergency management law in our state provides that the governor can declare emergencies in 30-day increments, and that's important. He can renew that, as he has done once already, but that's important because it's a way to say that these emergency situations are limited in duration. They're temporary. They're not intended to be permanent. And that's another protection to the constitutional rights that people enjoy and the civil liberties that people enjoy, is that this is a limited situation. We will move through it and past it in the months ahead.
Thank you, Joe.
Elizabeth Binion, PBS, Michiana.
Good afternoon, Elizabeth.
Good afternoon, Governor. I have two questions also. The first is a request for clarification, and the second is a new topic. Yesterday, you stated that we have to do everything we can to contain the virus and slow the spread if numbers start moving in the wrong direction as restrictions are relaxed. Does this mean that you stand ready to reimpose previously lifted restrictions if positive cases and deaths start climbing? And second, what role will your administration play in determining whether or not college campuses reopen in the fall, and what conditions and regulations will be required for students to return to the classrooms?
You know, both of those questions, Elizabeth, will be answered by the numbers. And it's not, like I said earlier, it's not just looking at deaths or looking at positive cases or looking at the number tested. It's where does that lead you? And I have always said that we have to make sure that we protect our healthcare system or our healthcare network. That was something we were very fortunate about in the state of Indiana. Others have been as well around the country. But right out of the gate, our healthcare system came together and said, we're going to collaborate and we're going to pool resources if need be. We're going to be able to, if resources are depleted or if room is needed or filled up in one hospital, we can partner with another nearby in that district. That has enabled us to continue to make progress along the way. But again, I just got to stress that while I do have a crystal ball, but it doesn't work. We don't know when this is going to taper off, but we know it's going to be a while. And so we know we're going to be operating in this posture where we're going to have to call audibles. And that's why I've approached this in kind of a 2-week or 3-week increment. To date, and as Joe said, the 30-day emergency order, that allows us to make these decisions. As for college or university schedules, just like K through 12, that's a decision that's not too far off. It's in the month of May that we're going to have to make that decision, and we have received input from our various institutions of higher learning, but we'll also be working with them to figure out how they would be able to safely accommodate their students according to what the numbers on the ground are at that time or leading into that time. So stay tuned, Elizabeth, for Friday, because part of this will be answered. Now the universities and the schools will deal with that after May 1st, but not too far off into the distance.
Brianna Cooper, the Indianapolis Recorder.
Hello, Brianna. How are you?
Good. How are you?
Great. Thank you.
I have 2 questions, both for Dr. Weaver. So to start out with expanded testing being open for people who are anyone who's symptomatic. For those who have tested positive but are no longer symptomatic, when should they be retested to make sure that they're no longer a carrier? And then secondly, recently the CDC said it wasn't necessary for people to wear gloves in public. And I was wondering if that's something you're recommending that people not do, and if so, how can we prevent the spread in places like grocery stores where things might be handled by multiple people?
Sure, those are both really good questions. So to start with the first one about retesting if you've already been tested positive. So retesting is actually not recommended on a regular basis. So we do know that when we test people 2, even 3 weeks after they've tested positive, they could test positive again, but we don't actually know if that means that they could still infect people. So there's lots of data, information, research out there trying to look into that. In some cases, healthcare workers are retested again so that we can make proper recommendations since they take care of at-risk groups. But for most people, there isn't a recommendation that everybody needs to go get retested in order to, I guess, prove negativity. For your second question, I absolutely agree about not wearing gloves in public. So as a healthcare worker myself, we're trained on how to wear gloves, right? So I use my hand sanitizer, I put my gloves on, I touch the patient, do my exam, and then I take my gloves off and I use hand sanitizer again. So the problem with going into public is that people aren't trained on the proper use of gloves. So you would go and touch several surfaces and therefore continue to spread the virus around. So my recommendation and what I've been telling other people to do when I go to the grocery store is I wear a mask, I bring hand sanitizer with me, and I just frequently wash my hands. The other thing I always remind people is that when you're walking around the grocery store, that's a good time to put your phone in your pocket or your purse, and don't touch it, because every time you touch something and go touch your phone again, you're potentially exposing your phone to some of the things that you may be touching on surfaces.
Kathy Treader, Ferdinand News.
Good afternoon, Kathy.
Good afternoon. Thank you for all you guys are doing. I really think our state's doing such a wonderful job with your leadership, and it's greatly appreciated.
We have a great team, as is evidenced daily.
I have 2 questions, and they're completely unrelated, so I'd kind of like to ask them separately.
Okay.
The first one and it may be for Fred. I feel like I'm getting to know Fred. I had gotten calls for some people who were self-employed who filed on Friday or when they were first able, and when they went back into the system, it showed zeros. It was to show what they would receive, and then they asked, what are we supposed to do next? They couldn't figure out if that meant they were denied. It didn't say denied, so I thought I'd throw that out there for all the self-employed people. That's question 1.
Okay, it's a very timely question. What's 2?
Okay, 2 is the schools in our area, for example, that are Title I, do feeding programs in the summer. But the requirements now say that kids have to come, the students who would be getting food, the food insecure kids, would come into the schools. And so far, there's been no waiver to that, and I'm wondering how that will proceed. Now there are an inordinate number of kids getting the free lunch that are being distributed throughout the counties where I serve. And they're kind of, the school corporations are wondering how they wouldn't have room for them all, plus certainly social distancing wouldn't be there if the kids have to come in there to eat. So is there thoughts on that already? Or?
Yeah, two really good questions, and I got a thumbs up from Fred Payne, and I got a thumbs up from Katie Jenner, so your answers are forthcoming. Fred?
Okay. So the answer to your question is more procedurally related. If you recall, the first phase of the rollout for PUA was really the application acceptance portion of the process. So the zeros that the person is seeing is more likely related to the fact that we may not have received all of the financial information that we'll need to populate that. So that doesn't mean anything is wrong just yet. It means that it's still working its way through the process. And if the individual will need to provide more information, we'll let them know.
And Katie, the second question?
Well, thank you for the question. Just to open, I think you provide a great segue to provide a thank you to all of our educators out there, teachers, administrators, school personnel, bus drivers who are pivoting and adjusting during this challenging time and doing the best they can to serve our Hoosier families and students. So specifically to your question, the Department of Education has a team. They have a federal grants team. I heard you mention Title I. They also have a food service team. So directly after this, I would be glad to circle with them and get that question straight to them. They have been excellent about answering district questions in a timely manner. And also you might check out, they have a frequently asked question document on their website that could answer some of these questions as well. But again, I will circle with them, and thank you for the question. And thank you again for all educators are doing during this public safety time.
And Kathy, Katie will connect with you after this as well.
Kayla Sullivan, Box 59.
Afternoon, Kayla.
Good afternoon, Governor. So today I wanted to ask a little bit about testing, but I specifically talked with a local epidemiologist who said one main reason Indiana is lagging in testing capacity is due to the fact it didn't have any big commercial labs. Would you agree with that? And what other factors do you believe play a role? A map from the Department of Health and Human Services shows Indiana's testing capacity is the worst in the Midwest and one of the lowest in the country. So what do you think was the cause of that? And obviously, you know, you announced today some of these new measures, but what leading up to this point was the cause, you think?
Dr. Lindsay, you want to talk even before today in comparison to our Midwestern neighbors, where we actually ranked?
Yeah, as of today, we're still ahead of several of our neighbors in the Midwest area, and I think that we're just going to continue to expand more and more with each coming week. So with testing, there's several factors that come into play, and each of those have been scarce resources. So it's not only having the labs available to do the testing, but do they have the right machine, and then do they have the chemicals and the equipment in order to run those machines? So we've been working really closely with our labs and also with Lily, who's been working with the labs to get everybody up and going to their greatest capacity. And then, as we've mentioned here before, it's the actual equipment that you need to get the collection done. So the swab and then the liquid to put the swab in. So there's several different components to it, and it depended on what time it was where we were a little bit lacking, but like Governor Holcomb said earlier, we've had a lot of people put a lot of work, a lot of thought into it, and Hoosiers have really, really stepped up in all aspects of it. So whether it be testing, data capability to help us with testing, I've been really impressed with what we've kind of figured out how to do here. And like I said, I think we're just going to increase more and more, especially with this new partnership with Optum.
Yeah, and Kayla, I mean, looking forward, if you're showing symptoms, you can be tested, and take that seriously. It is not spam. If it's got the Indiana State Department of Health on it, or if it's got in.gov, go there. We need you to sign up. So we're at 3,700, but we need 5,000. And with these first 20 sites standing up all over the state of Indiana, and ultimately then 50, we're going to be in your backyard. So if you're showing symptoms, go through that portal, log on, and go find out. So that's, you said 100,000 initially in this first month. We can do more after that. But now, if you're showing symptoms, you can be tested, and it's free. You're going to have to show, if you have insurance, you're going to have to show insurance, but you won't be turned away if you don't have insurance.
Michael, WBEZ.
Good afternoon, Michael.
Good afternoon, Governor. Thank you for taking my call. Listen, Lake County recorded its highest positive case since this all started, 129 today. Is this region really ready to reopen this weekend with it being so close to Chicago? And my second question has to do with this ongoing emerging health crisis in Cass County. They have 1,100 confirmed cases, most of them Latinos, because they work at that Tyson meat plant company there. Is enough being done to protect those workers? Because I've spoken to a couple of them, and they say Tyson is doing very little to protect their own workers and really can't be trusted. And with the president ordering these food plants to remain open today as essential, how can he order them to be open when the workers are getting sick by the droves? What's the state's role in this?
Lindsay, you want to take the second one second? I'll take the first one. The answer to the first question, Michael, is we'll see. I mean, when I say that we're going to make our final decision Thursday night at midnight, maybe the ink will still be wet at 2:30 on Friday. We're going to use all of our time to best be informed on Friday. We're not going to try to short circuit it. We're not going to try to cut corners. We're going to use the latest information. And yes, we will look at a region, as we've always said. But you mentioned cases. You mentioned one factor in this equation. And again, I would just ask you to contemplate the whole equation. And what do those cases mean to that healthcare system in that region? And what would it mean if we opened up certain industries or sectors in that region and they weren't across the border? That's why will also, before 2:30 on Friday, I will also be informing our neighboring governors about what we're going to do. We talk on almost a daily basis with various governors around the country, and we'll do the same leading into Friday. You want to answer? He had kind of a two-part question, or question in the second part.
Right, about Cass County. So the ISCH strike team was able to go in and test all of those people. And when we go and we do testing on site, one of the other things we do is we talk with, whether it be a group home or in this case a business site, and talk to them about what can we do or what can you do to better protect your employees. And the plant there was very receptive to any kind of information, instructions we can give. Additionally, we are contacting personally, the State Department of Health is contacting all of the positive cases, and part of that conversation is, do you have everything that you need, one, to take care of yourself, and then also moving forward so that we can answer any questions and talk about what it looks like on the other side.
Travis Robinson, Wish TV.
Good afternoon, Travis.
Afternoon. I just wanted to clarify some things on the Simon Malls front there. I just didn't know if the stay-at-home order got extended, would that push back the opening day for Simon Malls in Indiana? And if they do open, what kind of precautions are they going to need to have on hand there to comply?
Well, the ifs and the details will be shared on Friday. And I'm not trying to hide the ball. I'm not trying to be cute here. We're going to use between now and Friday at 2:30 to make sure we've properly thought through all sectors. And I would share it with you if I had it, but it's not ready to go yet. We still have more work to do, just being as honest as I can be, whether it has to do with malls or manufacturing or retail or you name it, sports venues, etc. We're going to answer those questions come Friday. And obviously, a mall or a retailer, you name it, They're going to look at what our guidelines are, what our recommendations are, what CDC's guidelines are, and see if they are able to operate in that environment. There are some businesses, by the way, who could operate right now, but are choosing not to for various reasons. Understandable, support that. When we've said that you can, it doesn't mean that you must. It means that you can if you're prepared to do it in a safe way with these new guidelines in this new world that we actually find ourselves living in. So we'll compare notes, we'll put out our guidance, malls, etc. will respond to that, and they will open if they can in this new environment in the state of Indiana or anywhere else, I suspect, in the country.
Mark Wilson, Evansville Courier and Press.
Good afternoon, Mark. Thanks for joining us.
Mark, you have to unmute your own microphone.
Good afternoon. My question for the governor is, has Governor Holcomb's relationship with Vice President Pence benefited the state in any way in the fight against the coronavirus?
Well, you should ask him. Well, our requests tend not to sit on a desk very long, so I would say yes. We've had a good shooting percentage when it comes to requests that we've asked for, waivers that we've asked for. I suspect, I don't want to assume any favoritism, because the administration has been very good at being in constant contact, not just with me, because the vice president calls Indiana his home state. They've been in constant contact with every governor, and so they are very accessible. Last week he called. I missed a phone call because I was here, and he called after the fact just to check in, just to make sure he wasn't missing anything from our end of the deal. So, you know, I think that they're being, I don't think that they're showing any favoritism, but I just appreciate that our requests don't linger.
Tom Davies, The Associated Press.
Good afternoon, Tom.
Hello, Governor. My question goes to, how was OptumServe selected to do all this additional testing? How much it will be costing the state to do this? And then how much of a increase will this mean percentage-wise for testing around the state, as the inability to people get testing has been a persistent problem across the country?
Yeah. You want to talk about the particulars of the deal?
So I think one of the great benefits of partnering with OptumServe is that they come with the full package. So from end to end, they are providing the people to do the testing, the swabs. They'll be sending them to the lab. They're partnering with local communities to where we have identified where there is need, and then they're going to work with the local communities to help communicate that to everybody. And then we showed you the first 20, but those local 50, you know, we'll see where they go based on hotspots, based on population, and again, like I said, based on need. So I think, to me, what they really are providing is that end-to-end communication with the patient, with the state, and all of the things that we've at times had difficulty getting for the state, such as the swabs and the PPE. So that's the best part. I'm trying to think, was there another part of the question?
Cost. Maybe you might touch on the benefit of, after 1 month, we could go 2.
Right, so we're going to do this on a month-to-month basis and keep on evaluating the situation and what they're providing for Indiana. I can't think off the top of my head what percentage increase that would be, but it is going to be pretty significant if we can get to 30,000 tests a week, which is what the goal is initially. Additionally, so the cost for the state is $17.9 million, but we are hoping that a good part of it, if not all of it, will be covered by federal grants.
And Tom, something else to just factor in here. Again, I'm not the doctor, so I'm not speaking for any doctors in this room right now, and there's a few. But what needs to also be contemplated in this, and one reason why we're excited about this first month and it being such a substantially high number, up to 100,000, and then the ability to go back a month later. But technology is our friend in this, and I think when new ways of testing come online, what you don't want to be is tethered to or tied to only one option when other products will come online in the future. Now, that may be 2 months, that may be 6 months, that may be a year, but we may be testing much differently down the road. But this is going to give us information now, and I think you mentioned folks are going to get the results within 48 hours. And so this is a quick turnaround. This is an inventory that's in place. This is a company that's, obviously she also mentioned working with California. So they're getting a snapshot out on the West Coast and in the Midwest. And we feel really good about not just where we are, but where we're going.
Sarah Clifford, the Brown County Democrat.
Good afternoon, Sarah.
Good afternoon. I have two questions, both for Dr. Weaver. Brown County only has 15 confirmed cases of the virus right now, but we're surrounded by counties that are in the triple digits. Only 61 of our residents have been tested so far. I'm wondering, how likely really is it that we only have 15 confirmed cases, and is there sort of a false sense of security in that number? And also a second question, several readers have asked us if the virus could have been here in early February when we had a lot of students sick in our schools and people were testing negative for flu, but had flu-like symptoms. Is that at all possible?
So the first question about Brown County, as we can see, and I think Cass County is a great example of that, if you test a lot of people, you're going to see a lot more positives, right? Especially if you're kind of a hot spot. So we do expect if we increase testing in Brown County that you would see more test positive. And that's one of the reasons why we have this very concerted effort to look across the state and decide really where do we need to have an increased capacity for testing. I think that we all need to continue to act as if we currently have the virus and others around us have it too. So every measure to do that, that social distancing and take all precautions is what is needed so that we don't have that false sense of security, especially as we start moving around a little bit more. As far as everybody being sick in early February, I've heard this several times. I think what will be interesting, and that's one of the reasons why we've partnered with IUPUI Fairbanks School of Medicine, is the serology testing that we're doing. So, you know, it will give us an indication of what is the prevalence of people who have made antibodies to COVID-19. So we'll be able to compare that, and over time, as we continue to do more and more waves of testing, will give us an indication of how much we have gone up over time. So I think it's something interesting that we've heard about before, but it's honestly, it's just hard to say, but we hope to get more information.
And Sarah, I would just also add that we'll continue to Lindsay mentioned partnering, and we'll continue to partner with local officials, be it mayors or town managers or county commissioners, and where they may be even more restrictive than we've been. This is not atypical or unusual in the country, and we're no different here in Indiana. And so if something is not allowed in Marion County, where we sit right now, but is in Hancock County, we'll work with the locals in both areas, and that includes Brown County as well, and your collar counties around Brown County.
Victoria Ratliff, the State House File.
Good afternoon, Victoria.
Good afternoon, Governor. My question is for Dr. Weaver. How many people need to be tested before it's safe to start reopening the economy? Do you guys have a goal, or is there guidance?
So I think that this is just an ongoing situation. There is so many data points, honestly, that come into any decision making. And me as a newcomer to state government have been very impressed by the number of people that are included in any kind of decision making, including bringing all the doctors into the room, the medical experts, the researchers, everybody to give a lot of input. So I don't think there's an exact number. I think, as Governor Holcomb said, it really is. I mean, we are in constant contact with our hospitals, talking to them about, you know, what does it look like? How do you feel? How do you think things are going on? Constant contact with our local health departments, our providers across the entire state, all of the business leaders across the state. So there really are a lot of people who are looking at this. And I think that just like in the beginning, things have changed almost on a daily to weekly basis, that we just need to be prepared to do the same as we start to open up things, that if we see things are changing, that we're prepared to then change course again.
Yeah, and I would just add that the economy is open to a certain extent, and it's not where we want it to be, but we have manufacturing going on right now. We have retail business being conducted right now. We have construction projects being done right now. And so for a state like Indiana, yes, we monitor traffic patterns and who's out on the road, and we have pleaded with, and again, 99.99% of Hoosiers are playing by the rules, and this has enabled us to not overwhelm our healthcare system. The question is not when are we going to reopen the economy, it's what parts of the economy will reopen and how they will reopen. And so that's a timeline. That is, as I mentioned yesterday, again, we don't have every T crossed and every I dotted yet, but that will roll out in stages. It will not be that light switch where the economy's open, we're all back to work, same thing as it used to be. It won't be that. It'll be in multiple stages leading through the summer.
Adam, WFIU.
Good afternoon, Adam.
Hey, good afternoon, Governor. I think you may have just answered my question, but I'll ask it just briefly again. Governor DeWine in Ohio had doing kind of a layered approach to reopening their economy, and it sounds like that's sort of the same phase or same method you may take as the next few days unfold here, right?
Very similar, and we talk more than once a week, Governor DeWine and I, and it will be gradual, it will be methodical, it will be staged, and that's in an effort to make sure that we don't jolt the system or overwhelm our healthcare system. We need to be steady as she goes, but we need to be moving forward, and we can be safely, and that's really the key is how fast can we go safely, and we won't go any faster than that.
Adam Wren, Indianapolis Monthly.
Adam, you followed Adam.
Yes, thank you so much. It's a good name to have.
That's right.
Just a follow-up question about the White House testing data that showed Indiana near the bottom of the nation and at the bottom of the Midwest. Are you saying we reject that data or that it's outdated? And how did Indiana struggle uniquely among other states that also struggled to get medical supply to perform more tests? Why was our struggle unique in this case that led us to lag behind other states in testing?
You want to go through the figures right now with our neighbors? I mean, just
Yeah, and so according to this, which is as of today, April 28th, so we are at 959. That was an increase of the 100,000 between April 5th and now. So we are increasing. We are ahead of Ohio, ahead of Kentucky, which I believe were ahead of us on the White House list there. So we're doing much better. I think Dr. Box has talked about this before. Where, because we weren't initially one of those big hot spots, that a lot of the resources got diverted to those areas, whether it be New York or Seattle in the beginning. And so there was a lag to us having access to the resources.
Our final question is from Annie Johnston, WTHI.
good afternoon. Thanks for joining us.
Good afternoon, Governor and Dr. Weaver. I have some questions regarding death reporting. For 1 week now, Vigo County has reported 4 deaths from COVID-19, while the state has reported 5 in our county. Today, county health officials told me they received the death certificate for the 5th death the state is including, and COVID-19 was not a primary cause of death as they suspected. The county says it will not include this death in its overall count because they don't consider it to be a primary COVID-19 death. So from what I understand after talking with the county and the state JIC, the difference in the data between the county and the state on this will remain. So my questions for you are, can you update us on how many other deaths are included in the state's reporting where COVID-19 was not the primary cause of death, and your viewpoint on including them? And then also, how are you addressing discrepancies with local departments to ensure Hoosiers are getting the most accurate information?
Yeah, so great question. I would say as far as the death reporting goes, so as you know, it is a delay in when we get some of those reports. So sometimes the local people do know before we know about a death attributed to COVID-19. Additionally, that is why we added that extra spot on our dashboard of deaths where COVID-19 was listed as a cause, but there wasn't necessarily a positive test. So when those deaths are reported, typically there are other causes of death listed as well, whether it be, acute respiratory failure or maybe COPD, and then COVID-19 is one of the line items. So we definitely go back, look at those death certificates, and COVID-19 is highlighted, and then so we attribute them to our total list, even though COVID-19 may not have been the primary cause.
Thank you for joining today's briefing.
All right, you've been listening to Governor Eric Holcomb and state officials giving us another update on the number of cases of COVID-19 in our state, the surge in testing, and also what their plans are for reopening up businesses that will be rolled out later this week. We'll have much more on what came out of that press conference today.